Hello and welcome everyone to the National Council of Urban Indian Health's info session on the electronic case reporting implementation opportunity. My name is Tiffany Stark and I'm one of the public health program managers here at NCUIH, and I'll be your host today. We would like to thank you for taking the time to meet with us. Next slide, please. So we are very pleased that you could join us today for this exciting opportunity. If you do have any IT difficulty during today's call, please chat directly to Comms and Events and Lamar can further assist you. And finally, if you could, please enter in your name, UIO, or external organization, any tribal affiliations into the chat box. That way we can get to know each other and also count your attendance. And just a few items before we begin. We'd like to also make sure that if you have video capability to enable your camera, this helps to create a more interactive environment. Also, please note that your microphones are muted, but you will have an opportunity during the open discussion to ask any questions. You can also raise your hand at the bottom if you'd like to be called on, or just unmute if there's silence and pop in. Our chat box will also be monitored as well, so please feel free to drop in any questions or comments throughout the presentation, and we'll address them at the designated time. And before we begin, we'd also like to note that this session will be recorded for educational and quality improvement purposes. And we will also be sharing the materials in a follow-up email with resources. And just a quick acknowledgement that this session is supported by the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services as part of a financial assistance award totaling $300,000, with 100% funded by CDC and HHS. The contents of those are necessarily represent the official views nor endorsement by the CDC or HHS or the U.S. government. And just to provide a brief background on NCUIH, for those folks that are new, our organization is a national nonprofit devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians, Alaska Natives living in urban areas. We represent the 41 Title V UIOs under IHS in the Indian Healthcare Improvement Act. We strive to improve the health of over 70% of the American Indian, Alaska Native population that lives in urban areas, supported by quality, accessible healthcare centers. And to get to the bulk of why we're all meeting today, so we would like to provide an overview of the ECR implementation program and then transition into the open discussion to answer any questions about the program or even with the application. And then we'll wrap up with some NCUIH events and funding opportunities that are still available. And so to start off, what is electronic case reporting for those that may not know? So this is the automated generation and transmission of case reports from electronic health records to public health agencies for review and action. So this supplement is specifically a campaign that's trying to help enroll healthcare providers, electronic health record platforms, and public health agencies. So ultimately connecting UIOs to technical assistance and educational support, transition to the APHL AIMS platform, which ultimately sends reportable conditions such as COVID to public and tribal health authorities, so county, state, and tribal. And this may look like a lot, but ultimately just to show the pathway in which the information is shared. So from the EHR onto the public health agency in between. Next slide. And so ultimately taking a quick look at the healthcare provider ECR benefits. So this saves time on manual data entries and reporting. It streamlines reporting challenges, fulfills legal reporting requirements, allows expansion to all reportable conditions, and offers credit through the CMS promoting interoperability program. And for public health agency ECR benefits, it accelerates response, improves communication in healthcare, enables bidirectional data exchange, monitors the spread of reportable diseases, and provides more complete data. And this is just showing a view of all of the healthcare facilities that are in production for ECR. And for the year 2 opportunity here at NCUIH, we are funding up to 3 UIOs with an award totaling of $84,600 each to help support with education and technical assistance support. And our applications are live and they are on a rolling basis. So we do have the links and also the QR code on the bottom right if you wanted to access that with your mobile phone. Next slide, please. And so now we'll move into the core requirements of the program. So the UIO must use an eligible electronic health record, EHR system that is not resourced in patient management system or PMS. Any commercial off-the-shelf platform that connects and integrates to ECR may be eligible. UIOs must ensure appropriate approvals from UIO leadership to help coordinate with NCUIH, Centers for Disease Control and Prevention, the American Public Health Laboratories, ECR technical advisors, EHR operations, and any other relevant party that will help enhance the existing electronic healthcare systems. Transmit case reporting electronically. So agreements must be signed between all identified parties as needed. And then also creating and submitting a work plan with a budget on how the 84,600, excuse me, will be utilized. So subject matter experts in ECR onboarding will be available to help assist in the creation of your work plan, establish the costs, time ranges, and coordinate with any EHR system. And then also another core requirement, submitting a quarterly status and end of the year report on the work plan, completing the NCUIH ECR implementation activities checklist, working with CDC onboarding team to implement strategies for ECR outlined in the work plan. And for UIOs who are using EHR such as Epic and eClinicalWorks, that is a big preference as those two softwares have been advancing with the implementation. And so here is a snippet of the ECR activities checklist to show the activities to receive the first payment of the two. So we have 3 activities to help get that started. Next slide, please. And then for the second payment of $42,300, we have some more activities that start to get into the program a little bit more in depth. And ultimately at the end, providing NCUIH with an integration report that highlights the challenges, successes, and also an accounting of the expenses incurred for the project. Next slide, please. And so this is the bottom portion that's referencing the integration report. So as mentioned, those success stories, challenges, the final accounting, and then also a narrative of the UIO provider's experience. And then we do have some electronic case reporting resources for you to look into. There's 2 videos that go over what it is more in depthly and the difference between ECR and traditional case reporting. So we will have these included in the email that will go out so you can access these resources. And so now we want to open up the floor for any questions that you may have about the program. If you have any questions about the application, anything that we could do to help assist you with the process.
Hi there, Tiffany. This is Heather, and I was just wondering if you could scroll back and show me the connection slide again. I noticed that you were using, there was a certain health information exchange that was being used, and I just couldn't quite catch it.
While you're looking at this, Tiffany, Dr. Walter Murillo's also got his hands up.
Oh, thank you. I wasn't able to see it with the view. Is this the slide that you were referencing, Heather?
Yep, it sure was. Thank you.
You're welcome. And Walter, I see you have your hand raised.
Yeah, in the announcement, it identified Epic and I can't remember the other one, but we use NextGen. Will we still be able to participate in this program?
Yeah, definitely. We were just showing that the preference for Epic and eClinicalWorks is just as we've been able to see that advancing a little bit more quickly. But yes, that could definitely still be a software that can participate for sure.
Thank you.
Thank you.
This is Abby Maho. One of the things that we've learned with some of the prior sub-awards that we've issued to UIOs is that they're utilizing the dollars for their internal systems for preparations to connect. There are no costs involved working with the CDC technical team. So I just wanted to put that in everybody's mind as you're thinking about applying for this opportunity.
Yes, thank you for adding that, Evie. Definitely helpful.
And then Tiffany, another question, just to be really clear, this will help report not just to the CDC, but also to our local, like, public agencies as well.
Yes, so ultimately this will help streamline that reporting. So you don't have to do the manual entries or having to go to different sources to provide that. So ultimately being like that one-stop shop.
Will this at any point be able to be accessed by IHS? Like, is there intention for them to be able to use these same files to get information about COVID testing and other tests that we would need to send to them?
That's something that I'm not aware of at the current moment in time, but I could definitely follow up on that because that's a good question.
Thank you.
Of course.
Would you be willing to forward to a couple more slides for me? Just the keep on going. I wanted to look at what is expected of us. There was two, like, to get the first part of the payment and then the second part.
The activities checklist.
Yeah, there you go. Awesome, thank you.
Yeah, the first part we really tried to make it kind of simple so then we can get that good jump start on the project. So just identifying the project director for this project, ensuring that the EHR system is ready for pilot, which this will, be verified with the ECR team and in the meetings, and then also determining cost of EHR customizations or upgrades. So just providing an estimate of what those would be.
Have you guys seen when working with other facilities that there's much cost on the EHR side? I know that sometimes when I've done connections for other types of interfaces, that it could be $1,000 here, $1,000 there, just kind of depending. Have you got a general idea of what that looks like for the connection?
Yeah, that's a good question. So it's been very minimal, next to nothing, from what we've seen. A lot of the EHRs are trying to, I guess, keep the costs down, since this is something that will ultimately help streamline the work. So it hasn't been anything very expensive from what I've seen so far.
Okay, thank you.
I think there's a question from Cynthia in the chat that is this limited to reporting of COVID only, or what is being used to identify the needs of reporting needs?
Yeah, that's a good question. So currently, I believe it is just the COVID-19 to start, and then it would be expanded to others as well.
And
go
add
ahead.
to that, yeah, I was just going to make a comment to add to that. Each state will have their own requirements on what those reportable conditions are. So as Tiffany alluded to, it would expand. So each of the UIOs would have specific reporting requirements to begin to discuss with the ECR implementation team.
Walter, do you have your hand raised?
Nope, just forgot to lower it.
No worries.
Can we take a look at part 2 now? Thank you.
Yes, and then so part 2 looks like a little bit, but once we're actually doing the work, it won't really feel that way. So it does become NCUIH and the CDC ECR team will determine if any PHA exists and initiate data exchange. So this is ultimately completed by the CDC ECR team, so no worries on that. But just to keep an eye on it, we have it listed. And then we have create with NCUIH and CDC ECR onboarding team a timeline for the pilot testing, and then complete the full connection to the AIMS platform. So this would be providing a timeline that includes those areas as mentioned. And then performing any necessary EHR upgrades or any customizations along the way. So attaching those as well. And then complete the connection of the UIO's EHR system with the AIMS platform for at least one reportable condition of COVID-19. And then at the end, providing that integration report with those components, with the implementation date, the provider's perspective, the successes, challenges, and then that final accounting for the expenses that were incurred.
I have a quick question for you, and maybe this is more technical and I need to talk to somebody else, but I currently have a piece of software that I use that allows my EHR to have our in-house labs drop directly back into the patient's progress note. And they are currently reporting for us to the local level. If I was to put this into place, do you think that that would be something that I would need to have them quit doing to prevent duplication? Or do you think that, you know, whether it's being sent to the CDC or it's being sent to the local level, that they would deal with it on the other end?
I'm not technically savvy, but I will say that your EHR, the company, would definitely be involved in the conversation and how it might be designed at your local level and how it might possibly integrate it if you have a system that currently works with our implementation, CDC implementation team. It might be integrated, but it's something that we definitely can explore if you're applying for the opportunity to definitely bring that up so that the entire team could take a look at that and begin to design, redesign, or enhance existing systems that may currently be working for your organization.
Awesome. Thank you.
Yeah, and that's a good point. The CDC ECR team is very good with helping with that support, answering those questions on a lot of the technical aspects that I myself may not even really know a lot of the stuff about because it's so technical. So it is nice having that support from them to help answer any of those questions, especially as you mentioned, there were like questions before about duplication with some other things, and they were able to help answer that for some folks. And also just to mention, if anybody has, any questions after this session about the program or, any assistance with the application, anything like that, I could definitely help assist with that as well. Lamar, could we advance to slide 22? Thank you. So before we conclude for today, we do want to remind folks of some upcoming NCUIH events. So on the 29th of November, we have the next Peer-to-Peer Solutions Center. So definitely join that if you're looking for any technical assistance. On the 30th, we do have a Missing and Murdered Indigenous People virtual dialogue. On December 14th, we have Vaccine Equity's Journey to Healthy Communities, focusing on COVID-19 guidelines. And then on December 15th, we have the other Peer-to-Peer Solutions Center, focusing on HIT technical assistance support. And both sessions for November and December we'll have James Spillane as well to help answer any questions for HIT and EHR. So just a reminder on that. And then for current NCUIH funding opportunities, aside from the ECR, we do have emergency preparedness and vaccination planning storyteller applications. That opportunity is open through the end of the month, I believe. And then we also have CDC IPC Project First Line. They have a couple sub-awards. They also have fellowship awards for undergraduate and graduate students, and then professional development scholarship as well. And so here we have the link for the application for the electronic case reporting, and also the QR if you wanted to access that with your cell phone. And we want to thank you all so much for your time, your questions. We truly appreciate you taking the time to meet with us. And if there's any other final questions or comments, we'll be hanging on the meeting to help answer those. But again, thank you so much, and I hope you have a great rest of your week.